So they ask about common and then principle of their, but now common characteristic of vertebral column. Let us see if we'll be able to do anything about vertebral column.
Vertebrates in spinal cord, yes?
Spinal cord is in vertebra.
Spinal cord is vertebra?
It's in vertebra. Not vertebra in spinal cord, but spinal cord in vertebra.
Is in vertebra.
Okay. Okay, and then we go like that. This one, as you know, it is intervertebral disc. It is cartilage.
Cartilage.
This cartilage, it ossifies only when you are 25. But before this time, when you are still younger, it is cartilage. But when you become more than 25, it changes and then it is no more there. It becomes bone. Ossification. Yeah. Okay, but now what we want to do here, now, why I did this one, they ask us about vertebral column injuries. So the common injury that can happen in vertebral column, first usually it may be dislocation of the disc. This disc, sometimes it can come out. I'll just draw two. This one will be normal. The next one, so as you can see, it comes out, right? It is supposed to be like this, but now it comes out like this.
Oh yeah, they are inside this.
Yeah, so this is some example of when we have problem in the spinal cord. Some people, they have this, but they don't know. They only have back pain all the time, but they don't know what is happening. So this is one characteristic of the injury that can happen to the backbone: displacement of the intervertebral disc.
Displacement, that disconnection between these vertebrae.
Yeah, it's not really disconnection, but like it moves from where it should be. It moves away from. You can see
it's called displacement.
Displacement of the intervertebral disc. So this one can lead to a very severe pain, and then it's just one of the things. Also, we can have fracture of the
vertebra.
Fracture of the vertebra. We can have that one. We can have what again? We can have also another one that they call scoliosis. We can have kyphosis. Yeah, but those ones, it is a situation whereby you are going to be seeing the vertebral column being.
What is scoliosis, symphysis? They are fracture.
They are not fracture. But they are not straight. You can see this one, right? It is bent.
This is called
This
vertebral.
one
Yes,
is
bent.
called scoliosis.
Scoliosis. That they are.
It is bent like this. See, this kind of person may be like this, or the person is like this. This is scoliosis. In another case, it can be like this.
Person is like that.
Yeah, and that one is kyphosis.
Kyphosis. So in this situation, the person like that, how the
It is
vertebra?
kyphosis.
Still,
No, of course, it's
I
going
mean
to
the shape of
bend.
vertebra.
It's going to bend to one side.
The vertebra became like that.
So, yeah, you can imagine it now. Everything just go like this. Just like that. That is kyphosis. You should have seen somebody like that before. So this one can happen. This one can happen. It can happen like this. It can happen like this. So, but now we are now talking about it. Ask us about the characteristic. We have the characteristic. This is the general characteristic for them, and then now they talk about maybe method of surgical treatment. 100 right. Common characteristic of the vertebral column injury. You understand? And then remember, we also talk about fracture too.
Fracture.
Then the principle of their operative treatments.
How you do treat? Yeah.
Yeah.
So it means that if the
intervertebral disc.
if intervertebral disc, if it is displacement, we have, and we have fracture of the vertebra, and we have scoliosis and kyphosis. They are all characteristic of the vertebra.
Vertebral injury.
So it means that if the vertebra became this injury happened maybe due to accident, something like that. Yes.
Yeah, it can be due to anything. It can be due to some bacterial infection like polio, myelitis. It can be due to some congenital abnormalities. It can be due to trauma.
Trauma. They are all characteristics. Okay.
And so these are the common characteristics. So in this one, it's going to lead to back pain because of irritation of the spinal cord roots.
It irritates spinal cord.
Roots, yes, of course. Spinal cord will be passing inside there.
So, Master, if this disc, how irritates spinal cord? For example, the disc.
Did you hear what I said? I said it 3 times. Spinal cord roots.
Roots. I forgot the root of spinal cord. I forgot the root of
Okay. Spinal cord. Let me see if I can still remember how to draw spinal cord. But I remember we have something like. I want to try. We are going to have something like. So usually we will have so we maybe I should just make, but it's okay, sure. Then we have this place that the cerebrospinal fluid will pass, right?
Yeah.
Then we have the in every spinal cord there are nerve roots that will be bringing information from spinal cord to the body.
Yeah.
This nerve that is coming from the spinal cord, before it's going to join with the anterior, we have posterior and anterior roots. Before they will come and join together, is what they refer to as, this is spinal roots.
Spinal root.
And then now it is going to be coming from here, But now, if this one is already been displaced, the one that are passing through here will be compressed.
Will be compressed with this one.
Yes, it will be compressed because this thing, it is supposed to be straight, but now it is no more straight. It's going to cause it's going to increase pressure to this nerve root, and it's
So
not going
it
to
make
be
that
cause of
even
pain.
not to transverse even impulses also make like that.
Of course, it will transfer impulses, but it will be slower.
Slower.
And then why it will be slower is because any impulse this one is going to be transferring by this time, it's going to be the pain.
Why it cause pain?
Let me show you.
No,
Let me
wait,
show you now.
wait. No, I say this one it will be compressed the nerve. It makes slower. But why it makes slower? Why it will be pain? For example, I take time when I do like that. For example, the person cannot do fast.
Even if you want to do fast, you need this thing. Impulse is coming from your hand,
Yeah.
going to your back, to your brain. It has to pass through your spinal cord.
Yes, yes.
Now it is coming. If it is coming and it is getting here, and here there is problem. There is problem. But before anything, do you remember that nerve does not work? Do you know?
No.
Nerve don't work. They only, it's like you think your eyes see, your eyes do not see. The only thing they do, they transfer light from outside into the optic nerve. Only optic nerve can see. If they remove optic nerve and your eyes is there, it is useless. It is the same thing like the nerve. This nerve cannot do anything. What makes you carry this pain is muscle.
Muscle.
Now, for muscle to do anything, it has to contract. As I am holding, it's very light, but as I am holding it, my muscle is contracting. If my muscle doesn't contract, I won't be able to hold this pen.
Yes.
And as I am holding this pen, as my muscle is contracting, anything that is between this muscle will be compressed. In the back that this nerve is passing through, it is passing through muscle.
Muscle, yeah.
And now, contraction from my hand to my back is going to also cause the muscle of the back to contract. As this muscle they are contracting, they are compressing the nerve. But already now it is not only the nerve that is compressing it, but the displaced intervertebral disc. This is the main cause of the pain that people have, especially in the lower back.
Lower back. Okay.
So it is one major reason why irritation of the spinal nerve roots is the main reason why people have pain when they have problem with the vertebra.
Muscle is also maybe friction also will happen.
What's that?
If this displacement will happen, friction between these vertebra. Also.
But that one is going to be in another infectious disease, in a situation whereby somebody is having systemic lupus erythematosus, somebody that is suffering from some kind of connective tissue disorder. So that one can lead to disappearance of this cartilage, and then it's now going to make it possible for the two vertebrae to be contacting each other, and then that one can lead to frictional pain.
Frictional pain, okay.
But it is less common except in people that are having some connective tissue disorders.
Okay.
It's clear.
Yeah.
Okay. Now, a method of correction. First thing is the aim of treatment. It's to remove pain.
To remove the pain, yes.
And how? Correction
of the intervertebral
affected vertebra or in the intervertebral
disc.
See, now if it is, we say what they do, they are going to actually have to open the cut open the at the level where there is problem. They are going to make incision. You understand? They are going to make incision, and please, you should also pay attention to it because it is very, very important. The incision they are going to make is not going to be like this, because if you do, you are going to
cut the nerve.
You understand? So the main thing that they do, is to under a CT scan, you understand, under CT scan they check where the nerve roots and blood vessels, because also there are blood vessels that are passing in between everywhere here. Blood vessel is passing in all of them here. Blood vessel is passing
to supply
here.
vertebra.
Yes, to supply the spinal cord, not vertebra, spinal cord. So all blood vessels are passing here. Therefore, if they want to do the surgery, they always come below the spine of the vertebra.
Spine.
This is spine. This is spine.
Below spine.
The spine.
That to avoiding cutting.
Vascular tissue. Okay. So now, as I have said, what they want us to do is mainly correction. If you can see, they said surgical principles of their operative treatment. So the principle, what you must follow. And so, and then the out of the principle, since this is the main thing that we want to do, we have to like correct the affected vertebra. And how do we do that now? So we are going to make incision, you understand, at the location of the affected vertebra.
Affected vertebra, of course. Yeah.
So you should note that if it is here, you cannot make incision here. You understand?
Go to the.
It is better to make the incision below here, you understand?
Yeah.
And then we can, if in a case when we know in time, we can easily try to replace this cartilage.
To go back.
Yeah, they can do it. What they will do after they push it back, they now place specific plastic here, and then they place another one here. You understand?
How is
sometimes they put iron. Metal rod, but that name I cannot remember actually, but it has a name. They place a metal rod. That metal rod may not be only for here, it may be from here, you understand, like they take three that it is long up to 3 vertebra.
Okay. Excuse me.
So sometimes they do, but I have forgotten. Maybe I will remember. I will send it to you on WhatsApp or when next I come. I cannot remember now.
Okay.
But it's a name they call it with the placement of the iron. So this is for and it is the same method they will use even if we have this one. What we do if we have this one is the same. First, sometimes this one we may need to like place for something like this. We may need to place just the metal rod, you understand, in here without this one and this one. If it is just this one, you understand that I'm trying to say?
Just only one vertebra?
Yeah, if it's just only like this one, all the vertebra is not having problem, you understand? It's just a fractional, and this one is going to cause pain because of the compression on the spinal cord when the person is moving. You understand? So they are now going to keep the person in one position for some time, so that this bone is going to be able to refuse. When it is fused, then they can ask the person to be taking some small steps. You understand? And then it can be corrected in this case. So, excuse me. As we say, application of metal rod. I will remember. I think I'm trying to remember. If I remember, I will still tell you application. But the principle is what they ask us. So if you know the principle, I know you have a lot of answer. Application of metal rods, okay, for up to 3 vertebra.
I mean, they can for 3 vertebrae to combine.
For up to 3 vertebra. You know, I said for up to 3 vertebra, it may be 2, but just not 1. Yeah, of course, not 1 because it is affecting 2 together.
Yes.
So it may be 2. Okay, then in a situation like this, it is this thing also that they do, but this one is going to be like
this is the principle for this one. If displacement of them,
but it is if for displacement, if it is displacement of just intervertebral disc, it is this one up to 3. But if in a situation whereby that it is up to this, You understand? Yeah, in that case, we may need to place the iron rod for all. Iron rod, but before that time, they are going to be reconstruction. In this case now, reconstruction, but it's not an easy procedure. Reconstruction of the vertebra.
Reconstruction of the vertebra.
It's a
What does it mean?
it's a very serious procedure.
Is that it make to correct?
Yeah, to correct. Like, it is not straight.
Yeah.
So how they are going to, like, but it's not a simple procedure. It is the procedure that they do, but it's not simple. It's not just for everybody. It's for only people that are rich, but it's also a part of the method of treatment. So reconstruction of the vertebra. And then, so application of the metal rods. This one, just don't forget this one. Application of metal rods and reconstruction of the vertebra. It is the main method that they can use to treat, depending on the severity of the injury.
Not for fracture and displacement, we use metal rod, yeah?
We use metal. This one is also, we use metal rod here.
Yeah, but
after you restructure, you have to restructure. Of course, you can see it is deformed.
Reconstruction, it means that how to make,
Change the form, change the shape.
You change in doctor.
You don't want to leave it like this now.
You make it correct. How?
Yes, reconstruction.
By how?
That's I told you, it's not something that is that easy. It's something that they may need a lot of surgeons to carry out. It is true. They may need a lot of surgeons to carry it out, because they will need to
reconstruction, and then they put metal rod.
Now of course, for all of them, they need to put metal rod, because the metal rod is going to, sometimes they will put the metal rod in some people's body forever. But in some other people, but also you should note that this application of metal rod is in general method of fracture treatment. Like if somebody has fracture, they use this for almost all. For almost all people that are suffering from it. I wish I remember. Yeah, I forgot. But maybe if I remember it, I'll just let you know. But there is a name for it, where they put iron rod in bone when they want to treat its fracture.
Okay.
So if I remember, I will just let you know. But the most important thing is to remember the application of metal rods, and then reconstruction in the case of scoliosis. And then scoliosis and kyphosis, they are usually deformation that are not usually due to trauma, but it may be congenital. It may be due to work the person is doing. If the person is working and it is like this all the time, the back can become like that. If the person is working and maybe it is to carry something, and then he's carrying this every day, this person can become like this. So they have to do the construction for this person first, and then they put the iron rods so that this thing will not be going back.
But this iron is for some time after the week.
Yeah, of course, yes. No, it is not forever. And then it will be resolved, and once it is resolved, they will be able to check if the person is actually back to normal or not.
Okay.